It is quite a hefty rise today in the numbers. How concerned should we be?
I think we should be moderately concerned. I'm one of those numbers at the moment, and if I needed reminding, which I don't really, I was away at the weekend with 8 friends. 6 of us have become infected so far, so a real reminder about how transmissible this virus is. It's causing cold-like symptoms. It does that for the majority. That's what it's been doing for me. Thankfully, the vaccination rates or vaccine and having had prior infection is still protecting us from severe infection, still protecting us against hospitalizations and increases in death rates, but it's not protecting us against just getting infected. And that's what we're seeing in these figures now. They're not a surprise. They've been on the rise the week before, and I think countries in Europe are seeing similar rises.
It's interesting you're saying that the vaccines are still protecting against more severe infection. Do you expect, as the case numbers tick up, hospitalisations to follow with the usual lag?
I think hospitalizations will increase just because of the numbers of people that are being infected. You know, if we're talking about 1 in 60 people in the country are being infected, then that's automatically 1 in 60 people who go into hospital at least have got COVID. COVID, up until quite recently, and still the case, is more of people have got COVID as an incidental finding in hospital rather than them necessarily being there for the primary reason of a COVID illness. And I think that will largely stay the same. There's evidence that the Omicron variants that we're seeing so far do cause a milder illness, certainly than the Delta virus that we've seen before.
I'm interested to try and unpick what is causing the rise in cases. Is it waning immunity? Is it the fact that we're all just socialising and mixing more than previously? Or is it because the 2 Omicron variants that we've seen more recently are just more infectious?
I think it's probably a combination of all those things. It's certainly the case that with the new variant, people's immunity is not protecting them against being infected. With every new variant, it's able to evade the immune system a little bit, and so it allows us to get infected. And in the setting of generally people's awareness, COVID has dropped out the news quite a bit recently for understandable reasons. And I think certainly in the summer and people being and meeting again. So I think the combination of immunity waning and because of people mixing and getting together, those 2 things are what's driving the increased rate.
Do you think that we should start considering, I guess, some of the preventative measures that we saw previously? I'm thinking about, things like limiting our social interactions, mask wearing, or actually are we now at a time when, look, we're just having to learn to live with COVID, and if there's no sign that this new variant or is more severe, then we should just get on with it, I guess?
Yeah, I think we're taking the route of the latter. But what people do need to know, if it is bad for you to get COVID, for example, if you've got a health condition or if you live with someone who's vulnerable or you really don't want COVID just before you go on holiday, then doing some things to try and prevent you from getting infected, so avoiding large crowds, wearing a mask on public transport, making sure you're up to date with a booster vaccine if you're eligible for one, just to prevent you getting, significantly ill. Where I think the effect is going to be is not so much, hopefully, the deaths and hospitalisation rates, but the effects on workers, because certainly for doctors and nurses getting COVID, they can't go to work. You've heard about Gatwick reducing their flights because of the impact on staff. So staff who work in public-facing roles, if the infection rates go up, that's where the wider public are going to start noticing disruption.
Just one other, we've certainly seen the disruption, I have to say. One other thing, while I've got you kind of non-COVID related or linked to COVID, if you like, it feels like we're seeing, maybe this is, anecdotal, but an increase in people going into hospital or children catching respiratory or other viruses at this time of year, which does feel a bit strange with the kind of summer months. Is that, do you think, because of a lack of immunity to viruses, because of the isolation that people were experiencing during COVID? Is it a real thing?
It's definitely, I mean, COVID is certainly, with the numbers we've just seen, COVID is still dominating. But I think you're right that there are other viral infections out there. You're also right that because we've been so good at isolating and wearing masks, then the numbers of infections of other viruses we've seen over the last 2 years has really plummeted. So we will have lost a little bit of immunity to those types of viruses. So I think, yes, you're right. We are in a living now with more viruses, particularly COVID, but some of the other things as well, and learning to live with them.